This video will demonstrate how to place an oesophagostomy feeding tube in a cat. Several techniques are available, but this video will show the technique using curved forceps. Equipment should be prepared and include materials to clip and aseptically prepare the skin, a feeding tube size 12 to 14 French depending on the size of the cat, a marker pen, tape, scalpel handle, suture material, curved forceps, Carmel for example, needle holders, small forceps for suturing, an empty 5ml syringe, a drape, sterile gloves and sterile swabs. The cat will be anaesthetised with an endotracheal tube in place and placed into right lateral recumbency. Measure the feeding tube from the mid-cervical esophagus to the 8th intercostal space and mark the tube. The left lateral neck has been clipped from mandibular ramus to the thoracic inlet and extended to the dorsal and ventral midlines. The area is prepared aseptically. The correct site for tube placement is identified in the mid-cervical esophagus, avoiding the jugular vein ventrally as indicated. Forceps are inserted into the cat's mouth to the mid-cervical region and the curved tips push dorsally to tent the esophagus towards the skin. The tip of the instrument is identified by palpation and a small incision made through the skin and the esophageal mucosa onto the tip of the forceps. The incision is extended to allow the forceps to slightly protrude from the skin and open enough to grasp the end of the feeding tube. The end of the feeding tube is grasped in the jaws of the forceps, which are closed. The tip of the forceps, with the feeding tube, is pulled back into the esophagus. The tube is pulled along the esophagus and out of the cat's mouth with the closed forceps. Hold on to the other end of the feeding tube to avoid inadvertently pulling the entire length into the esophagus. The forceps are now opened and the tube released. The tip of the feeding tube is now curled back into the cat's mouth and fed into the oropharynx using fingers, or the forceps can be used to direct the tube gently, avoiding any trauma to the mouth. Take care to avoid the tube becoming tangled with the ET tube and the securing tapes. As the tube is passed into the esophagus, the proximal end coming out of the neck is gently pulled. This results in the tube straightening in the esophagus and is felt as a subtle flip. The feeding tube should then pass easily further into the esophagus. Pass the feeding tube up to the marked level. Check the oral cavity that no tube remains. The incision site should be re-prepared aseptically and gloves changed if they have been in the cat's mouth to minimise contamination. The tube is secured in position with a finger trap suture, avoiding over-tightening of the sutures in the skin to maintain the cat's comfort. This may be done before or after checking tube position, for example with radiography. But do take care not to dislodge the tube if the cat is moved when the tube is not secured. Then, placement of the feeding tube is checked with a lateral thoracic radiograph, ensuring it terminates in the distal third of the esophagus. Other methods of assessing placement include fluoroscopy or endoscopy. A light dressing or fabric collar is used to secure the tube in position and should be checked to ensure it's comfortable for the cat and not excessively tight. Analgesia should always be provided.